Hello, I am Dr. Praveen Chandra. I am an interventional cardiologist and working as chairman of cardiology at Medanta Medicity Hospital in Gurgaon, Delhi NCR. TAVI, which was a new treatment, now has seen rapid advancements in technology, in experience and the outcomes. And that has happened because the technology has developed quite rapidly and we have made devices thinner, more easy to use, and the outcomes in the short term and the long term are showing very positive results. So that is why we need more and more advancements to make it even more thinner, more usable, and of course we are looking at a brighter future, as I can see. The safety and efficacy of this technique of replacing the aortic valves through the TAVI procedure and without doing any surgery has been shown very effectively in many studies, and recently a study was done in very low risk patient, which means where doing surgery was also low risk, but they tried to do TAVI and found that TAVI was very good in these patients. So a large number of patients can now be treated by TAVI procedure with great degree of efficacy and very low risk patterns. The cost of the procedure and the affordability by our own patients in India has been an issue with this procedure because it is rather expensive, but with the advancements in technology and with more experience of these manufacturing companies, the cost has come down, and the Indian companies which are particularly now manufacturing quite good quality products are really bringing the cost down by almost half, and that is why more and more patients are now being treated. So almost half of the patients being treated in India are getting the made in India valves, which is effective and is also safe and is affordable. The biggest challenge in sometimes when there is a new procedure is that very few people are trained to do that. So this challenge is generally met with various methods, and one of the methods is that we as far as I am concerned and my center is concerned, we get doctors from all over India and abroad on a regular basis so that they can see the procedures being done, they can get trained to do that, and then we also go to their centers to train them, hold their hands so that they can learn this procedure quickly. And the last thing is that sometimes we even do live cases through which a large number of people can see that. And let me tell you, I learned it by these three ways: seeing the live cases, seeing the procedures being done in other labs, and then of course doing it yourself. So that is the learning process which is very important, and we cannot skip that, and a set number of procedures have to be seen by the individual before he starts doing it. My experience of these about 600 or so odd procedures which we have done in the center and also in some other centers. So it has been a long journey. I mean, it was not very easy to start with because the device was new, it was not so easily available, and then getting the nuances of which patient is the best one, which device will suit which patient, all that over a period of time has evolved quite in a big way for us, and now 99% times it is very easy to make a plan and execute it within no time. So the procedure time has shortened, the stay of the patient in the hospital has shortened, and of course since the devices are also available on the shelf, we can do it. If I see somebody today, I can do it tomorrow. So my final message about this procedure is that it is a very safe procedure, effective procedure, and we can depend upon this procedure. And the other important thing which patients also ask this question: how long will it last? So I must say that the longevity of these valves have been shown very well now, up to 10 years, and they are doing very well. So that is not an issue, and so many physicians who are seeing these patients should feel comfortable and confident to advise these procedures to their patients.